For me, public health is really about increasing access. And I think public health is so important now because we're facing healthcare crises where we have tons of people who need services and can't receive services in our country.
It's the combination of treating not only a disease and not only a patient, but a community.
I like to think about public health as really the bird's eye view of medicine, and it's at the population level instead of just the individual level.
Working within the specific economic and political and cultural climate to really bring the biggest health impact to the most people that you can.
So public health really forces you to pull back, to see that patient as a person, but also to see the circumstances surrounding that person.
I chose for my MD MPH because it really was the best program available for what I would like to do. For me, it's really important to become a physician who can treat populations and treat adults and children and also have a worldly knowledge with my healthcare.
I think this program is really amazing in that it combines both medicine, taking care of one person, and public health, which is taking care of an entire population.
One of the great advantages of the program here is that you get the medical degree in 4 years, but you also get something much more, which typically takes 2 years, and that's the Master's in Public Health.
We don't really think of medicine and public health in silos. You don't think of them in a vacuum. In the real world, they exist together, and here we're actually learning and practicing how it will actually play out in the real world.
Well, when I was first looking for programs for medical school, I wanted a dual program because I thought it sounded really innovative. I wasn't entirely sure what I was getting into. With this program, you do everything in 4 years, and the entire time you're thinking of medicine from a public health mindset, and you're also thinking of public health from a medical mindset, and the whole thing is just intertwined.
Getting an MD and MPH, you really are able to get a really diverse skill set that you can then apply to really trying to enact positive change in the healthcare system.
One experience that the dual program offers us is a rotational program through several of the community clinics that are doing work in Miami. So there is a pediatric mobile clinic, a clinic specifically for a homeless population, a clinic for low-income Latinos, and a clinic specifically for Haitian community.
Every student in this dual degree program has to do a capstone. It's kind of like your thesis for your master's in public health. So you have to pick a capstone project that's public health related. It can be really anything.
My research project that I'm doing for my capstone is focused on pediatric immunizations. I'll be going out in the community and talking with community leaders and public health physicians to learn more about the issues of immunizations.
I started my capstone field experience going down to Haiti. I went down there to kind of do a needs assessment of what the community was like at the time, kind of taking an inventory of the medical climate.
Being a part of the MD MPH program, we receive not just support in terms of mentorship, but financial support.
I was the recipient of a global health scholarship, which brought me to Geneva, Switzerland, to work as an intern at the World Health Organization.
Now in my second year, I'm also receiving support in the form of the Springboard Grant. And the Springboard Grant has allowed me to develop the Overtown Health Theater project that brings together community members and health professionals around chronic illness prevention.
In Miami, you're able to have the best public health education and the best hospitals to work with.
For me is like home.
Miami has an energy that you don't feel anywhere else. It's the weather, it's the palm trees, and the blend of cultures. It makes it really hard to be stressed.
You can go to the beach and you can feel like you're in the Caribbean. Basically, there's something to do every day for everyone. And also in terms of learning about medicine and public health, there are so many populations and communities and organizations that you can work with to get a really awesome experience.
It's a really vibrant city. It's extremely culturally rich.
I think if you're an ideal person and you want to save the world while being a good physician and who's capable of communicating with all entities involved with healthcare, I think this might be a good program for you.